Welcome to Fixing Obamacare Nonpartisan, video number 1.
Nonpartisan?
Would you believe that neither Democrats nor Republicans really understand health insurance?
I actually can believe that.
Unfortunately, it's true. Let me explain. When Obamacare started in 2014, of 310 million Americans, about 80% had group-type health insurance, such as employer plans, Medicare, and Medicaid. The main goal of Democrats with Obamacare was to cover the other 20%.
A great idea.
Those 80% had health insurance with normal-type deductibles.
Sure, deductibles, of course.
Well, the size of deductibles is very important, as we will see. Of the other 20%, undocumented persons were excluded by law. That left about 50 million that Democrats wanted to cover. And of those, about 15 million already had individual type policies before Obamacare.
I see the big problem. 35 million people without health insurance.
Right. So I'm going to be talking throughout about the 80% with group type coverage and the 20% or so without. For those without group type coverage, the last resort is always individual type coverage, if they get insurance at all.
So what did the Democrats do?
Well, they saw several problems. First, some people couldn't afford the cost. So they designed subsidies aimed at lower and middle income people, subsidies often large for more than half the population.
Very generous.
Yes. Second, the need to cover people with pre-existing conditions, the uninsurables.
Who had been excluded from health insurance.
Not really excluded, since nearly all states had some arrangements for covering uninsurables, such as high-risk pools, and some of those worked well, others could be improved.
Okay, Democrats decided to cover uninsurables. At what premium rate?
Obamacare charged them the same premium as healthy people.
The same rate as the healthy?
Yep. Third, some people might still not purchase health insurance, so they added an individual mandate. All must buy health insurance or face an IRS penalty.
Forcing people to purchase health insurance.
Supposedly, although there were many exceptions to the penalty.
Republicans hated the individual mandate.
Many Republicans hated it. And there was one more problem. Even for those 15 million who already had individual type health insurance policies, Democrats didn't think all those policies were adequate due to exclusions or limitations. So Democrats designed a whole new set of Obamacare individual type policies with lots of added benefits like preventive care, no exclusions, no limitations, pay benefits forever, premium subsidies to over half the population, covering uninsurable people at the same premium rate as perfectly healthy people, and all enforced, or supposedly enforced, by the individual mandate. Does that sound great?
Sounds almost too good to be true.
Unfortunately, it was too good to be true. The result was high premiums and huge deductibles. High premiums and huge deductibles. So almost half the people who were supposed to purchase those policies did not choose to do so.
What went wrong?
Very generous benefits and poor plan design caused high premiums and huge deductibles, made worse by adverse selection.
Adverse selection?
Those people who went without health insurance, was it more likely they were the sicker people or the healthier people?
Oh, healthier ones more likely to opt out. So the ones remaining were less healthy on average. Then premiums go up further.
Right, that's adverse selection. In Obamacare, overly generous benefits and poor plan design caused high premiums and huge deductibles. Many people, especially healthier people, chose to not purchase those policies.
But the individual mandate still must have caused a big jump in policies.
Not so fast. Let's look at the statistics from the Congressional Budget Office about individual type policies.
Individual type?
Well, remember, there was also a Medicaid expansion if states approved.
Yes, I want to know more about that.
Okay, yes, definitely. Here's that 20% group from 2014, the ones Democrats wanted to cover, about 50 million. In 2017, we see in brown, Medicaid now covered about 17 million more. Aside from that, we have in green about 18 million with Obamacare individual type policies, and in red, about 17 million still uninsured.
Only 18 million with individual type policies? That's not much higher than the previous 15 million, even with individual mandate and penalties.
Yep, the 18 million includes 10 million sold through exchanges and 8 million sold outside exchanges.
Huh? What's the difference?
Subsidies. Subsidies are only on the exchanges, so the 8 million purchased outside exchanges are unsubsidized. Most of the 10 million purchased on the exchanges are subsidized.
So some policies are subsidized and some are not subsidized.
It's a very important difference. We'll look at the subsidies a little later.
I knew that the number of uninsured people was greatly reduced. I assumed people were buying the individual type policies.
Not really. Almost all the reduction in the number of uninsured was due to Medicaid expansion, not to the purchase of individual type policies.
Looks like for individual type insurance, Obamacare was almost a failure?
Good intentions, but overgenerous benefits and poor plan design caused high premiums and huge deductibles. Many people chose to not purchase the policies.
You keep talking about so-called huge deductibles. What's huge?
Obamacare deductibles averaged about $5,000 a year nationwide for bronze policies, which are the least expensive metal tier.
Bronze, metal tier?
Obamacare has 4 metal tiers: bronze, silver, gold, and platinum. Bronze policies are the least expensive, so people look at them first.
I have trouble believing that average deductible of $5,000 a year.
So, you want me to prove it?
Haha, yes, prove it.
Okay, I'll prove it. You have a smartphone, right? Go to healthsherpa.com, a free website.
What zip code?
Mine is 19002. Try male, age 55, annual income $50,000.
Let's see, 4 Obamacare bronze policies, $5,500, $6,500, $7,150, $7,150. Wow! What are the premiums per year?
Annual premiums $6,000 a year, deductibles over $5,000 a year. Now pretend you're deciding whether to buy this policy. Pay $6,000 in premiums out of pocket every year. If you're hospitalized, another $5,000 for the deductible. That's $11,000 out of pocket. Would you buy that policy?
Well, I'd think twice about it. The deductibles are shocking. $5,000?
I was shocked myself when I found out. I knew some might doubt it, so I took 70 random zip codes nationwide, 709 bronze plans, and here are the results. In 2014, bronze deductibles averaged $4,866 a year. That's almost $5,000 a year. In 2017, the average deductible is even higher. Look up bronze policy deductibles for yourself.
But if that's true about huge deductibles, why is no one talking about them?
Well, remember that 80% of the population with group type insurance has normal deductibles. They're not aware that the other 20% face huge deductibles on bronze plans, which are the least expensive plans.
The 80% don't know what's happening to the 20%?
Yep. And the 80%, who usually have jobs and therefore employer health benefits, do most of the talking on TV.
You mean the Republicans' critics don't understand about huge deductibles?
It's rather odd. How often have you heard anyone talk about huge deductibles?
Not much about huge deductibles, mainly about high premiums. But didn't those subsidies help? How much are they? Who gets them?
Mainly lower and middle income people get them on a sliding scale. Let me show you some charts I did in 2014. Single person age 55 showing income levels across the bottom from $30,000 to $100,000. Average premium in 2014 was $4,686 a year nationwide. But look at the green area at the left, a large subsidy at lower income levels. For a person making $30,000, the subsidy offsets more than half the premium. The pink area on top represents the added $5,000 deductible that would be paid out of pocket if someone is hospitalized, for example.
What about a family policy?
Well, let me show you using age 55 again. This 2014 chart for a couple age 55, 2 children. Average premium in 2014 was $12,040 a year nationwide. Subsidy pays the entire premium at $30,000 and $40,000 incomes, and over half the premium even up to $90,000 income a year. The deductible on bronze family policies averages about $10,000 a year, $5,000 per person.
$12,000 a year premiums and a $10,000 deductible? Wow.
Remember that the impact is very different for subsidized people and unsubsidized people.
What do you mean?
Well, the unsubsidized people bear the full brunt of high premiums and huge deductibles on bronze policies without any subsidies.
Who are they, the unsubsidized?
In general, families making over $100,000 a year, individuals making over $50,000 a year.
So the unsubsidized get hit the worst. What about the subsidized?
The subsidized people have some financial help from premium subsidies, and they are required by law to purchase silver policies with lower deductibles. And many of the subsidized people have additional help from CSRs, cost-sharing reductions, to lower the deductible further.
So there really are 2 different categories of people affected, the subsidized and the unsubsidized.
Yep. Anyone trying to fix Obamacare must look at these 2 categories separately. The ones most affected by high premiums and huge deductibles are the unsubsidized.
So people must accept a huge deductible on bronze plans?
Or they can pay a higher premium and upgrade to silver plans with lower deductibles. Remember, bronze is the lowest cost plan, so it's the first one people see.
Right, they may not look farther, but I'm concerned about something. Aside from the Medicaid expansion, there were a lot of people still not covered.
Yep, 17 million without insurance, according to CBO, despite the individual mandate.
I wasn't aware of the huge number of people left without insurance. Are they all the unsubsidized?
No, many of the people who have subsidies available still choose not to purchase.
I'm learning a lot.
Well, you're right to be concerned about families or individuals without health insurance because each of them is a potential tragedy. A heart attack or a cancer diagnosis with no insurance means they may face even bankruptcy. And again, the 80% are not fully aware of what's happening to the 20%.
Why are the premiums and deductibles so high on Obamacare?
Obamacare is overly generous, overly rigid, and overcharges younger people. And it adds a lot of extra benefits like preventive care. But the biggest flaw is charging seriously ill people the same premium as healthy people.
Oh, the uninsurables. I really wanted to understand that.
Good, that's the final issue I wanted to cover in this video, number 1, and then we'll summarize.
Good. Everyone says uninsurables need coverage.
Right, and Republicans now agree they must be covered in some way. But the question is, should they pay the same premium amount as healthy people the same age?
What should be done? You can't charge them a huge premium.
And you don't. For the higher risk people, there's a standard insurance way to handle this called high risk pools. Obamacare didn't use it.
But you can't charge really sick people a high premium.
And you don't. When 35 states had high risk pools, they limited the increase to double the standard rate. In fact, the majority limited the increase to a maximum of 50% higher, like $150 a month instead of $100 a month.
That's not much of a difference.
Not much of a difference at all, given that the cost of the really sick may be much, much higher. So the 50% higher could be thought of as a very low price for that group of people. Let me explain risk pools using auto liability as an example. You have drivers with normal driving records and some with poor records. Should they pay the same amount?
No, of course not.
Right. You place the poor drivers in a separate risk pool, sometimes called assigned risk. And if a company sells 8% of the total policies in a state, it takes 8% of the poor risks.
Okay, so far, who sets the rates for poor drivers?
The government sets the rates at a reasonable level, state insurance departments.
But the risk pool policies will lose money.
Yeah, they'll lose lots of money.
So the insurance companies hate that.
No, the insurance companies love it.
Huh?
Insurance companies love it because all their competitors must also take their share of the poor risks. There's no competitive disadvantage. And insurance is a very competitive business.
So who pays for all those losses on the risk pool policies?
In auto liability insurance, the insurance company adds the cost of those losses to the premiums charged for other policies, like its competitors do. No outside subsidies are needed.
So it all works out?
Works well. Poor risks get covered, insurance companies compete, the competition works to keep premiums lower, no need for outside subsidies.
Could that work for health insurance?
Yes, except that there's usually a need for some subsidies because of the cost of the uninsurables. You can cover part of the cost of the uninsurables by spreading the cost to other policies, like in auto liability insurance, but you can't cover the entire cost. Although that's what Obamacare did in effect. That's one of the main reasons for the high premiums and huge deductibles, that they took the high cost of the uninsurables and spread that to everybody.
Oh, so why didn't competition keep Obamacare premiums lower?
There were no risk pools, among other reasons. Insurance companies under Obamacare can't tell in advance how many of the bad risks they're going to be covering or how many their competitors will cover, because that cost may be shifted to them by special arrangements.
Special arrangements?
Such as risk adjustment or risk corridor.
That some call a bailout for insurance companies.
Well, special arrangements are needed because there are no risk pools. Can we review?
Yes, let's review.
Okay. Both Democrats and Republicans need to learn lessons from Obamacare about individual type policies, which are the policies of last resort for those without group type insurance.
Individual type insurance is always necessary unless you go to a single payer.
And a Republican-led Congress this year is very unlikely to pass single payer. And a nation with deficits of over $400 billion a year probably can't afford single payer unless it gets its budget costs under control. There are also issues of control and waiting times. Americans don't like waiting, which is always part of a single payer system.
Oh, so the lessons?
The Democrats' goal was to cover everyone with health insurance. Obamacare was a well-intentioned attempt, but it didn't succeed due to overly generous benefits that caused high premiums and huge deductibles.
Will Republicans do any better?
Probably not. The Republican plans in the House and Senate have many of the same flaws.
Well, what lessons should Democrats learn?
Lesson number one for Democrats is that if you try to do two things at once, extend coverage to everyone and make all coverage more generous, it's likely to backfire. It caused high premiums and huge deductibles. Lesson number two, if they want to cover everyone, their urgent need is to get more healthy people into the insurance pool. Lesson three is that to get more healthy people to purchase, there must be low-cost, bare-bones policies available, subject to minimum requirements.
Okay.
Now, the Republicans have lessons to learn as well. Lesson number one is that the Republicans must provide health insurance for uninsurables, and that is difficult. Lesson two is that to provide coverage for uninsurables, Republicans must get as many healthy people into the insurance pool as possible. And they're trying to do that without requiring risk pools and without an individual mandate. Lesson three is that to get healthy people into the insurance pool, Republicans must have low-cost, bare-bones policy choices available. Lesson number four is that the Republicans might want to consider accepting the individual mandate for two reasons. First, to help provide coverage for uninsurables, because that's difficult, but also to help negotiations with Democrats about Medicaid expansion.
Yes, Medicaid expansion is certainly an issue. How do the two parties actually find a path forward to fix health insurance?
That's the topic of the other video, video number 2, on fixing Obamacare Nonpartisan, the path forward.